Hello YouTube, this is Ebony with PCOS Discussion. We're going to talk about fertility drugs. Okay, so the most common fertility drugs are normally given in tablet form. Okay, and those would be Clomid, Femara, or tamoxifen. There are others, but those are the main ones that are given. Clomid, also known as clomiphene citrate or seraphine, is a tablet that you take 5 days in a row consecutively in the beginning of your cycle, usually while you still have your menses. Okay, it can be taken chart day 1, 2, 3, 4, 5, or 6. There are some people that take it starting chart day 7, but for the most part, most doctors will prescribe you from chart day 3 through 7. So you're taking it chart day 3, 4, 5, 6, and 7. Okay, if you tend to take it earlier, some people notice that when taking it earlier, they have more follicles maturing, which will increase the incidence of having twins or triplets. And others find that taking it later in the menses cycle tends to have a more matured egg, which will allow for it to fertilize more easily and to implant easily. You know, so it all depends on what you're trying to achieve, what you have discussed with your physician, and you know what works best for you. Okay, so there are a lot of women who are Clomid resistant. A lot of PCOS women are Clomid resistant. Not all, but there are some. And some doctors may choose to give them Femara, which works the same way. The milligrams are a little bit different, and they don't have certain side effects that Clomid has. Clomid, some women find to dry up their cervical mucus and also to thin the lining in their uterus. So Femara, women tend to say, and doctors tend to say, does not have that effect. So that may be a plus. So if you find that Clomid is not working for you, or you may not feel like that you feel like you're having those side effects, you may want to talk to your doctor about Femara. Tamoxifen, which is utilized just as Clomid and Femara, is a drug originally supposed for breast cancer patients. And they found that it increased the levels of the hormones to help induce ovulation. So it is also given in the first days of your menses, and it helps to produce ovulation in a woman. I'm not familiar with the side effects, but I will research it and try to get back to you if you have any questions about tamoxifen. Both Clomid and tamoxifen are on the Target pharmacy and Walmart pharmacies $4 generic list, which is great. So if your insurance doesn't want to cover any fertility drugs, you can go to your OBGYN and get that prescription and take it to one of those pharmacies without having any insurance or without using your insurance card, and go there and say, please, I would like the generic version of the Clomid and the or go to Walmart and ask them for this generic of Clomid or tamoxifen. You have to be sure of the milligrams that they offer. So if you look on their websites, they'll have a list of what milligrams their $4 generic covers, and you know, you speak to your doctor about which one you two agree on the prescription. As for the $4 generic, it's not really $4. Clomid is an expensive drug, so the generic at Target and at Walmart are actually $9, which is still a great bargain, because Clomid could have run you anywhere up to $100 prior to it being on the generic list. Okay, so let's see, that's it basically for the tablet forms. There are other tablet forms out there, but Clomid, tamoxifen, and Femara are like the major medications that are given in tablet form to help you induce ovulation. Okay, another type of medication given are injections. Those are gonadotropins, which are synthesized hormones that are injected, usually intramuscular, into your muscle, or subcutaneously, which is right under the skin. And it just really depends on the size of the needle on the tip of your on the syringe. So if it's a shorter needle, that's usually the subcutaneous needle, and it goes right into the skin, right underneath the fat there. Or it can be it can be intramuscular, which goes right into the deep muscle tissue. And you know, if you have a good person that's injecting you, it's not bad. Or if you learn how to inject yourself, because sometimes the office will teach you how to inject it in yourself, it might not hurt as bad. You know, you may find if you do it slower, it won't hurt. Or if you go into a certain spot on your skin, it won't hurt. But most doctors like to use the intramuscular way because they find that it makes the drug more potent, as opposed to putting it subcutaneously. But either way, it works as long as they're monitoring you to make sure that your eggs are maturing. So usually when they prescribe you those drugs, which you may find may be under the name of GONAL-F, GONAL apostrophe F, I'm sorry, hyphen F. So that's GONAL-F, or Follistim, which is another version of GONAL-F. You may have Repronex. You may have a few drugs. Can't think of all of them right now, but there are a few injections. Most common are Follistim and GONAL-F. You know, they do give mood swings, like I said. If you find it to be unbearable, just speak with your doctor. Maybe you need a lower dose, but realize if you have a lower dose, it may take longer to achieve the goal that you're trying to achieve. Like, you know, you might have to take it for longer days. It's not like Clomid where you take for 5 days and then you stop. You have to take it as long as they're looking to see your eggs maturing. So you can go up even up to 10 to 12 days of taking these injections, depending on your dose and depending on how your ovaries are responding to the medication. Once the doctor has seen that your eggs have matured, depending on if you're taking a tablet form or a syringe form of drug, they may want to give you something called an HCG shot, and that is a trigger shot, as they go to say. That's a human chorionic gonadotropin. It's usually, you know, given around maybe the 14th or 15th day, or depending on how mature your egg becomes. It can be earlier than that or later than that. Once your egg gets to the size that they're looking for, usually around a 2.0, or they may call it a 20, size 20, they're looking for it to be a specific size so that it will be a great candidate for fertilization. And the trigger shot is usually given intramuscular, and normally they'll give it to you in the office. Some doctors might give it to you to take it home, but most of the time they do it in the office because at that time they have looked at your ultrasound, and they'll give it to you right after they find that it's the best time. Okay, so in that as well, not all doctors will give it for Clomid, because sometimes, you know, you don't really need it for Clomid. Clomid can help you just to ovulate on your own, or, you know, Femara will help you to ovulate on your own. But some doctors, if a few eggs have matured with the Clomid, they may want to go ahead and give you the trigger shot so that all the eggs release. Because especially with PCOS patients, you already have problems with immature eggs staying on the ovary. When you have an HCG shot, it assures that all matured eggs, or slightly matured eggs, will fall off of the ovary so that you don't have that problem. Okay? What can be a problem sometimes is like hyperstimulation. Hyperstimulation is when you have can be like 10, 15 eggs. You know, they might want to cancel that, that cycle. They might give you a shot and then they'll tell you do not have any intercourse, or they might decide not to give you any shot at all, or they may give you something that will help you not to ovulate. That drug is called ganirelix. Okay, it depends, but you have to speak with your doctor. And if you're having so many eggs and you're trying to achieve IVF cycle, that might be an ideal thing for you. So because they're going to be taking the egg right out of your ovary, as opposed to it just coming off on its own. Okay, so but there are so many drugs out there. Like, again, you want to do your research, you want to speak to your doctor, see which one is best for you. And as you're taking them, you want to be mindful of the side effects that you are experiencing. You want to discuss that with your doctor. And if you're finding any of the side effects to any of the medications that you're taking to be unbearable, you want to discuss that with the physician too. So maybe that they can adjust the dosage, or maybe switch you to something that has a little bit less side effects. Okay, and then you also want to make sure that whatever fertility drug that you're taking, that it doesn't, you know, contradict any other you know, medication that you're taking. Any contraindications, you want to make sure that whatever drug you're having, because if you're taking something like a diuretic, you might not want to take a specific drug where, you know, it's like basically flushing that drug out of your system and it's causing it not to work. So you need to speak also, I guess, with your primary physician, with your OBGYN, and with your RE, and let them all know what drugs you're taking. You have to update all of them. And try to stay with the same pharmacy, because most pharmacies are good with keeping a record of all of your medications. Especially, I know Target, they're very good with that. If something is contraindicated, like, you know, you can't take two things together, they let you know immediately, and the pharmacist will come and discuss it with you. Okay, so that's a good thing. You know, try to stick with the same pharmacy so that they can keep track of what medications you're currently taking. All right, but for the most part, women have success with these fertility drugs. Sometimes you have to take a break to let your body get a resting point if it's not working at that time, and then try again, you know. But do what you feel comfortable doing, and that's all I got to say. You know, I'm very, very strict on educating yourself. So make sure you educate yourself. Find out these side effects and find out which doctors will give it to you. Find out where you can get it for cheap, and find out what you like. All right, so I'm signing out, and next time we'll talk about something else. Bye-bye and good luck.